Hello, Robbie. You're on the air.
Hello, Doctor.
Yes, sir. How can we help you?
Thank you very much for taking my call. So, my question is, so my wife and I were trying to prepare for the next pregnancy. Our first pregnancy, our child had a birth defect. He had a tibial bowing he was born with. So my wife right now is kind of pre-diabetic.
Okay, I missed that.
I don't know
said, what kind of birth? Wait a minute. What kind of birth defect did the first baby have?
It was posterior medial tibial bowing, so that his tibia is not straight.
Okay. Okay, so it wasn't something missing. Okay, just the tibia wasn't straight. So he was born with osteoporosis kind of thing. Yeah, okay. Okay, so you're preparing for another pregnancy.
Yeah, she is about 5'3", 145 pounds. She's pre-diabetic. So how do we prepare?
Okay. Now, Charmaine, what would you do? We only have minutes here. Charmaine, what would you do to see if Robbie's wife is absorbing nutrients?
Well, she needs to get on a gluten-free diet. No wheat, barley, rye, or oats. No oils of any kind. No burnt animal fat, and no fried food.
Okay, and what test would you give her? What test would you give her to make sure she's absorbing?
I don't know. Is there a test? Well,
a hair analysis.
Oh, hair. Okay. Yeah.
Yeah, get the book, Rare Earths Been Cures. Get the book, Rare Earths Been Cures. Go to chapter 10, 11. Tells you how to collect the hair, how to package it, where to ship it. Don't forget to put the check in there because they're not going to run it without the check. Okay? Within a couple of weeks, you'll get the results back. And if all the bars for all the nutrients are below the bottom line, she's not absorbing. Okay? I mean, that's the problem when a lot of times when there's birth defects. It has nothing to do with genetics. You're not absorbing, so even if she's supplementing, she can't get the nutrients to the baby. Okay? So it's imperative. You know that. But she's got to, as Shar says, she got to give all the bad stuff. No fried foods, no processed meats, no oils, no gluten, no wheat, butter, rye, oats, no sugar, and she's got to eat like an Asian. Rice, sweet potatoes, fish, poultry, red meat, but nothing fried. Okay? No gluten, no wheat, butter, rye, oats, no sugar, and all that kind of stuff. But I would get a hair analysis. I mean, we get requests for hair analysis, and the samples, 3 to 10, and some days 3, some days 10. We get them constantly all the time because people want to know, why am I not responding, to my medication? Why did I have to take a shot for my diabetes when the oral medication didn't work? Well, that's because you had a gluten problem and you couldn't absorb the medication. Why did my antibiotics fail me? I took oral antibiotics and they had to amputate my leg because it wouldn't cure the infection. Well, that's because you weren't absorbing it because you had a gluten problem. Okay? And so it's one of those things where you really, really, really need to know, am I absorbing? That's a basic thing here, whether you're taking pharmaceuticals or supplements. And so that's imperative here, Robbie. You and your wife both should get a hair analysis, and get the book, Rare Earths Been Cures. Again, go to drjwallach.com, get a hold of, that quartet of books, get a hold of the new Wallach's Corpus, and don't forget the book, Rare Earths Been Cures, tell you how to collect the hair, how to ship it, where to ship it, and in a couple of weeks you get the results back, and it'll blow your mind. Sometimes things that, doctors say, get a hair analysis, you get it, and for instance, your calcium is off the chart. It's way up there. And you got to stop drinking dairy, no cheese, no calcium supplements. Well, that doctor should have his license taken away. The reason why the calcium goes up in your hair analysis is you have raging calcium deficiency, and your parathyroid glands are pulling calcium out of your bones, raising the calcium in your hair. Oh, and you wind up with osteoporosis and fractures and all kinds of stuff, okay? When really you need more calcium, not less, and the doctor's telling you to take less calcium because he didn't even know how to interpret the hair analysis. That's the beauty of the book. It tells you how to interpret all these variations, okay? And so it's very wise to do all this, especially when you had a little problem here with the first baby. Let's give super care to the second one.